Hello again. This station is for surfactant replacement and also is be taught by Miguel Moreno.
Okay, so let's go ahead and see the objectives that they want us to know about surfactant. Correct dosing volume of curacao for patient-specific weights. Now, two ways of doing this. The easy way is looking for the chart where it's going to have a table with the weight and the correct doses. If for some reason you cannot find either of all those tables, so they also have pretty cool pocket cards where you can get the dosage is. Just remember, it's very easy to remember the dosage is 2.5 mLs per kilo. So with that aside, let's go ahead and continue. Our next objective is going to be the correct depth insertion of the multi-oxygen catheter. Well, first of all, we need to know how to set it up. Right out of the packet, we're going to have this little hose here, looks like a little hose, and a bunch of adapters. Now, all of those adapters are going to be marked with a number that belongs to the size of the ET tube. Now today we're going to use probably the most common size ET tube that we're going to be using when administering surfactant, and that's going to be the 2.5. Now what we need to do with a in this case, either if it's a 2.5 or a 3.0, we're going to remove the default adapter, and usually they're pretty easy to remove, and we're going to replace it with the one that's given to us. Later on, we'll go ahead and demonstrate how we'll do this on a patient connected to a ventilator. Obviously, it's going to take more of an effort. Now, once that's done, obviously this is the part that's going to connect either to the ambu bag or to the ventilator, so we can deliver breath. And then this part here, this is where we're going to connect our adapter. Going to take the blue cap off, and then we're just going to stick it here. So from this side, we're going to connect our syringe. Once we pull the surfactant, we just connect the syringe here, lock it in, and then we can go ahead and it's ready to do the administration. Now, to figure out the depth, now that's why we're doing it live, so you guys can see how far in we want to go. The tubing is going to have markings that are going to correlate with the markings on my tube. Now, usually I'll take a reference from my ET tube, like in this case I can use the 13 reference here, and then I'll look for my number 13 here, which is going to be color coordinated, which is going to be between the red and the blue marking. So the only thing I need to do is go ahead and introduce my tubing all the way to that 13 number on my tube. It's going to be between the red and the blue mark. See, once I go in between those two numbers, I can look at the tip of my ET tube, right in the middle, so right where the tip ends. Okay, now some people are going to say that you want to go like 1 centimeter before, some others even say 1 centimeter after. I definitely do not like the after part because we're dealing with a very small trachea, so that way we can go to the right main stem. So once I know if I did a correct insertion of the ET tube, I like to go right where it's marked, right where the tip of the delivering catheter ends with the end tip of my ET tube, and then from there I can do the administration of surfactant. Books, recent literature says it doesn't matter, you don't have to divide the dose, you can just give one dose. Some people still like to give the 2 doses divided in 2, rotate the baby, so just I guess communicate with your doctor first, see what's going to be his preference. Now we're going to demonstrate how we'll be doing it on a ventilator while it's running. So I'm just going to have this ventilator going on for a little bit. Obviously you're going to hear some launch, but we can hear the air going through. This way I want to demonstrate how fast we can go ahead and do it. So first things first, I have my ET tube connected to the ventilator. I want to identify the correct adapter. In this case, going to be the 2.5. So the first thing, this is probably the most stressful situation of this maneuver, is switching over the adapter. Because what we're going to do is, in a very fast way, I'm going to disconnect my patient. Obviously somebody's helping you secure the tube. Take this part out, connect the other one, and reconnect my patient to the ventilator once I have it in. Connected. See, as you can see, it only took me roughly about 10 seconds to have the baby disconnected from the ventilator. Once that's connected, another thing that catches your attention here, this is a pre-cut ET tube. Now that doesn't change none of the technique, because I can still identify my number. Now I can see, kind of rotate it here so we can see. I can see a number 10 here, okay? So that's my first number. I'll go ahead and identify where my 10 is here in my ET tube, which is right here before my color coded, okay? So I'll just keep track of my number here. I'll start introducing, and I can rotate it here, see my numbers, okay? So 7, 8, 9, 10, there's my 10, and I'm going to push it all the way to my 10 here. There we go. And then if we look at the tip of the catheter, it's right at the end of the ET tube. Great place to administer the surfactant.
Perfect. Okay, very good, Miguel. Very good.